Hi, I'm Dr. Vaibhav, consultant pulmonologist. Today I'm here to enlighten you all about the topic bronchitis. So bronchitis means inflammation of the airways. Airways are the ones which carry air to your lungs. So bronchitis involves inflammation of usually the medium to large size airways. So there is another term called bronchiolitis. So usually these terms are confused. So bronchiolitis is inflammation of the smaller airways. The major difference being in between these two is bronchiolitis is a condition which is seen in smaller children, whereas bronchitis usually affects older children or adults. So now let's look at what are the causes of bronchitis. So before that, we can categorize bronchitis as acute or chronic. So usually acute bronchitis is something which lasts for less than 3 months, and anything which lasts for more than 3 months is categorized as chronic bronchitis. So the most usual cause of acute bronchitis involves infections, and in infections, viral infections are on the higher side. So viral infections can affect anywhere starting from the nose to your respiratory tract, causing inflammation of the airways. So the symptoms which are usually associated with this kind of presentation is cough, which can be associated with a lot of mucus production, breathing difficulty, wheezing and chest tightness. So now talking about chronic bronchitis, so the most common cause of chronic bronchitis is usually tobacco smoke or air pollution. So this is seen most commonly in older generation or older adults. Again, the symptoms of chronic bronchitis are pretty much similar to that of acute bronchitis, so there is not much of a difference between these two. The main difference between acute bronchitis and chronic bronchitis being that mostly acute bronchitis can be a reversible condition if treated at the right time, but chronic bronchitis may also be associated with permanent airway damage. So now let's look at how we go about diagnosing this condition. So usually the diagnosis of bronchitis involves a test called the pulmonary function test. So this test assesses the capacity of your airways and can let us know if you're having any obstruction in your airways. So there may be some other diagnostic tests which we can use in cases of bronchitis. For example, chest X-ray or blood test. So these may be done when we are suspecting an infection or any other cause of bronchitis. So now let's look at the treatment aspect of bronchitis. So before we start with the treatment of bronchitis, it is very essential to know what exactly is the cause of bronchitis. So that helps us plan the treatment better. So the main treatment of bronchitis, mostly in case of both acute and chronic, involves use of inhalers. So once the diagnosis is established, the use of inhalers is what gives the fastest and the best relief for the patients. Some tips on how to prevent bronchitis. So you can do that by keeping your surroundings clean, disinfectant items around you, use of masks, and get proper vaccinations, and also prevention of smoking. So if you are facing any of the symptoms as mentioned above, do not delay and please do visit your doctor and do not self-diagnose or self-medicate. Stay healthy. Thank you. To get more such informative videos, please stay tuned.